Good morning, everyone. Thank you to the Scientific Program Committee for allowing me to talk about this exciting new technology. Here are my disclosures, which are not relevant to this particular talk. So what is ChatGPT? ChatGPT is a conversational AI model, in particular, a large language model. It is designed to understand and generate human-like text based on the input it receives. GPT stands for Generative Pre-trained Transformer. The generative component refers to the autoregressive model that predicts words or tokens later based on previous words or tokens. The pre-trained is because the model is trained upon a huge corpora of data, and the transformer refers to the architecture of the decoder. So ChatGPT operates using advanced deep learning techniques, particularly the AI transformer architecture. This allows the model to process and understand context and conversational language. By training on a wide range of data sets, ChatGPT learns to generate responses that are coherent and contextually relevant, making it a powerful tool for various applications in communication and information dissemination. OpenAI was founded in December of 2015, and the ChatGPT series was initially introduced in November of 2022. Just as a marker of its wide-scale adoption at this point, you can see the speed. So a lot of people use this kind of race to 100 million users, and if you look at the various platforms that are in existence now, you can see that ChatGPT raced to the 100 million user mark. ChatGPT has gone through various updates that has improved enhanced capabilities and performance, and it's one of the fastest platforms to now over 5 billion monthly visits, which is quite significant. The focus of the talk today is just to give you guys some ideas of things that you can play around with, and I say play around with because it's relatively new in your practice to potentially increase the productivity of your practice using ChatGPT. So the first obvious thing is patient support. The concept of a virtual health assistant or a chatbot that provides patient support round the clock. It's convenient for patients. They can go online, ask a question, and almost immediately get an answer. Obviously, the initial concern is these answers have to be accurate. Many of us have moved to call centers just because of the large volume of calls that we receive. But those call centers essentially just reroute the work back to medical professionals, nurses, MAs, and you still have to call the patient back at some point. If you implement practices where medical professionals, medical assistants are reviewing the chats that come in, often you don't have to call the patient back. You just verify that the response was reasonable and appropriate, and that saves time and energy. Appointment management. It's crazy that we do this for restaurants every single day, and we haven't integrated this into our practice. Sending patient reminders of upcoming visits could potentially decrease the number of no-shows. Also, allowing patients to have access to integrated calendar systems within our EMR will enable patients to say, well, I can't make it this day, but I can reschedule for a day somewhere down the road. It also allows them to see open surgical times, and so they can pick a time based on their own preference. So patient education is one of the obvious areas, and if you look at ChatGPT, it enables patients to basically take control over their own health. They can sit there and investigate a condition or a treatment. This has been going on for years, right? So patients have been turning to Dr. Google to essentially figure out something about their disease progress or a potential treatment. But I would argue that this distills all that information in a much more manageable way with less medical jargon. And actually, it's not just ChatGPT. If you actually look at the algorithms now that Google is utilizing, now the top algorithm, and this was a recent switch, is an AI-generated summary similar to ChatGPT based on large language models. So HR is an obvious location. Here's an example of me using ChatGPT to generate a job description. Saving time, this would probably take me 45 minutes to an hour, and then you can read it, refine it, and then post it on Indeed. So then when the resumes come in, and now you're faced with 20, 30 resumes, you can actually screen those resumes, again using ChatGPT, to the initial job description and see whether or not the candidate's a good mix. Also, you can produce educational material for HR, for new employees, and help with onboard training. This is happening all over. So AI, whether it be through external applications or internal applications, will pretty much universally be in every EMR system that we work. And here's an example of probably the largest electronic health record systems, Epic, working with Microsoft to integrate ChatGPT capabilities into their EMR system. This is also, and I think Mo alluded to this, and just in terms of saving work, we used to have people that would take minutes at your meetings and generate transcriptions from the meeting and summaries, and now AI can assist us in doing that in a way that ultimately you can send a summary of the meeting, and you can also send to-do tasks to people that were at the meeting. So this is one of the newer ways that we can utilize ChatGPT. So many of you may have heard of insurance companies using AI algorithms and lawsuits related to that to systematically deny patient care. And many in this room have to deal with the prior authorization process, which can be burdensome. Organized neurosurgery through the Washington Committee is fighting the battle every day in DC, but until we get that burden lifted, I would suggest that we can use ChatGPT in novel ways to help us with the process. So here is an example of us putting in the guidelines for Blue Cross Blue Shield, and it can be specific to the insurer with a lumbar spinal fusion. And if you think about it on the other side, that's what the medical director is essentially doing. They're sitting with their guidelines, and they're taking the clinical documentation, and they're seeing if the two mesh. Using ChatGPT and taking your office note, you can basically paste that office note in, instruct ChatGPT to compare the guidelines of Blue Cross Blue Shield, and it does an initial review of your note. Why is this useful? Well, if you get to the point that you're having to do a peer-to-peer, dealing with a denial at the last minute because the documentation isn't there, this enables you time to go back in, provide supportive clinical documentation to what your planned procedure is, thereby saving time, potentially decreasing denials, and improving workflow. The other system that a lot of the insurers will use is radiographic criteria. And they don't have access to the MRI. They're not looking at the imaging themselves. What they are looking at is the words from the MRI report. So this is particularly useful for semantic AI systems because essentially what you can do, and this is an example I'm using Aetna. So Aetna uses a mild, moderate to severe, or severe grading system for the degree of stenosis. And their requirement is that you have to have at minimum moderate stenosis at the surgical level. And so by taking our MRI report and putting it into ChatGPT, we can see whether or not that terminology is present. Why is that useful? Well, I've actually had to do denials because I'm not operating at an asymptomatic level because it had reached that moderate to severe radiographic criteria. So by going back and putting clinical documentation in why I'm not treating that level saves me a phone call, saves me a peer-to-peer, and it also will enable you, if the radiologists don't use that particular terminology, sometimes they'll just say stenosis, there's foraminal stenosis. You can preemptively reach out to the radiologist and say, listen, could you amend this to use the appropriate terminology? So just as putting everything into place, I think some in this room may have had the original mobile phones, which is vastly different than the smart devices that we have in our hands now. But it's the applications that have enabled us to do everything from book travel, order food, see what our friends are doing halfway across the world. And when you look at the fact that ChatGPT has only been around since 2022, you can see that the future and the speed with which this is going to evolve is going to be tremendous. However, despite the massive potential that's there, we can't just unleash AI on our patients. There's something called an hallucination, which essentially occurs when an AI system, such as a language model or an image generator, produces information that's just not grounded in reality, is incorrect, and honestly sometimes just made up. It can happen for a variety of different reasons. An example to give is you could get this very plausible, long, detailed historical event where everything looks accurate, you believe it, but it never occurred. The reasons for this often are related to the way that the model is trained on the data initially. It could be errors within the way that the model is designed, and sometimes it's issues with fact cross-checking. So I would argue that the integration of ChatGPT in surgical practice offers significant benefits. There are limitations with respect to protecting patients' data. There are obviously medical legal issues, which I think Jack Knightley will speak about a little bit later. But I do think that when you look at the overall potential for large language models such as ChatGPT, it is tremendous and will ultimately change the way that we practice on a day-to-day, freeing us up to do the things that we want to do, which is take care of patients. Thank you very much.